Jim Payne, who works at SelectHealth and has been a great example at successful behavior change and lifestyle change. And he's also been able to maintain that. So really want to take the opportunity to thank Karlee and Jim for being here. And I'll go ahead and turn the time over to them.
Great. All right. Well, so thank you again. I feel like you and I have gotten to know each other a little bit more. I know I wasn't your Way to Health instructor, but I've been so glad to know more about like our participant stories and what you've been able to do in the program, what you've been able to advocate for us in the program. So thank you again for being here today. So kind of give us an idea, remind all of us, I believe you started Way to Health back in 2019, is that right?
It's actually 2018.
2018, so, gotcha, okay.
Yeah, it's been about 3.5 years since I started, so it's September, 2018.
Okay, perfect. And so you started September of 2018, finished up in 2019, maybe that's where I was kind of confused, right? Yep. And so with that, over the last few years, kind of tell us a little bit about the things that you learned, the things that you felt like really changed your life, what was meaningful then, maybe what's meaningful now.
Yeah. So kind of take a step back a little bit. You know, I work at SelectHealth, and one of my responsibilities in our sales team is to talk to folks about our wellness capabilities. And I just kept going over and over again, looking at the Way to Health program. I thought, you know what, I've got to do this. This would help me out greatly, because I kind of looked at, you know, my life and what I was doing, and my blood sugar levels were not good. I was almost pre-diabetic. And I thought, okay, I've got to do something there. And my weight was not good. I knew I was overweight, and you know, my feet were hurting. And I had 3 grandsons at the time, and I thought, you know what, I want to be around enough to be able to enjoy life with these guys. And we had history of type 2 diabetes in our family, and I thought, I've got to really try this. And so, fortunately, I heard about Way to Health through SelectHealth, and so I enrolled in September, and it's been awesome. The program, you know, you go the first 6 weeks. It's every single, I think it was a Tuesday night that we went, every Tuesday night at American Fork Hospital, because I live here in Highland. And so for the first 6 weeks, you go every single week. And then after that, for the next like 12, 13, 14 weeks, you go every other week. And then the last 6 months, you go about every month. And right here is our Way to Health binder. And a big shout out to Michelle Francis at American Fork. She was our leader there, and she's the bomb. She's so good. And so we had a team of us that started out the program, and just real quick, I was just going to go through a couple of things that we talked about. You know, we talked about the psychology of eating, exercising, principles of healthy living, emotional eating, menu planning. I even looked here, and I recalled that we actually went to Albertsons for one night and spent a couple of hours going through and looking at the nutrition labels and understanding what to look for, and thinking that, oh, great, I've got such a low fat option here. And then you look at the sugars and you're like, oh, shoot, that's not going to work. So anyway, that's kind of why I went, you know, to the Way to Health program to begin with, and just a quick overview there. So I don't know if I answered all of your questions there, Karlee.
There was a lot in there, right? Sorry. I love that you still have your Way to Health binder. That's awesome.
Yeah. Yep, sits right next to me here at work, so I get to pull it out every once in a while just to remind myself of what I need to be doing. So
awesome. Yes, that's great. So I know you knew about the program. What specifically led you to the program, or what were your biggest motivators? Was it was it that family? What else what were you thinking at that time?
Yeah, so as I mentioned, for my family, my blood sugar levels were not good. And frankly, I've had battles with my weight since I was a little kid. And I was really good at losing it, but I was really, really good at gaining it back. And so I was tired of kind of the ups and downs throughout my life. And so I thought, you know what, I need to do something that's going to be sticking, that's going to make a difference so that I'm not doing the yo-yo weight loss anymore. And so that was really the biggest motivator. And, kind of jumping ahead a little bit, but 3.5 years after I started, I kept off the initial 25 that I lost, and I have not gained any of it back. And I even dipped another 10 pounds below when I got COVID the other couple of months ago, because I couldn't taste or smell. So I didn't eat anything, but that kind of came back. So, but anyway, I'm really excited that I can report that I've kept it off for that entire time, and I'm going to continue to do that for the rest of my life, and hopefully even, go even lower as far as weight loss goes.
What do you feel like has been most impactful or most helpful, or what changed to have you keep off that 25 pounds? Because like you said before, you were good at kind of doing the roller coaster, going up, down, back and forth.
Exactly. Well, Michelle Francis, I've mentioned, the classes that really jumped out at me that made the biggest impact were going to Albertsons and understanding the food that I was buying. And some of the stuff that I got regularly, I realized, God, this is just not good for me. And just understanding, eating whole grains and more fruits, more vegetables. That was a big impact right there. So just really understanding the nutrition that I didn't really fully understand, and especially carbohydrates. People think that carbohydrates are a horrible thing, and they're not. They're a good thing, because you need those to be able to exercise, right? But when I just lowered my carbohydrate intake, it made a huge impact on how I felt and what I was able to do. So it was nutrition. And then the second thing that was a big thing for me was understanding exercise. I'd been fairly active, but since I started taking the program, I just religiously make sure that I exercise. I have never been under 5 days a week that I haven't exercised. And it's just become part of who I am and what I do. And maybe the third thing that was the biggest impact of how I've been able to maintain is that for that entire year, I had a calorie counter. And so every meal that I ate, I put in what I ate, the calories and the nutritional value of everything that I ate. And then I also put in my exercise for the day to, be able to lose those pounds. And then after I did that for an entire year, actually it was after the first 9 months, then I said, okay, I don't need to do this anymore as far as counting calories, because it just became ingrained with my everyday knowledge of what I could do and what I could accomplish. And so those were probably the three biggest things. And once it became a habit, it's just part of my everyday living and, understanding what I need to do to maintain that weight loss.
I love that. Yeah. Three big things that, probably most people could at least do or could think through in their own lives, right?
Yeah. And the thing is, it's, for me anyway, there's no magic bullet, right? As far as fad diets, yeah, they can get you to a point pretty quick, but then where do you go from there? And so it really was, for me, again, it's going to be different for everybody, right? But for me, it was, just fewer calories intake and more exercising, and making those things habits every single day is what worked for my situation. So
you've mentioned habits a few times. one of the reasons why I think Way to Health is so amazing and why I believe in this program, and the research seems to be backing it up pretty strongly, is that it is a year-long program. So with this year-long program, what was your experience? What do you feel like the benefits of that year-long program? I personally think some of the benefits are that you get to have time to form those habits, but what, yeah, tell us about your experience during the entire year.
Yeah. So one thing that it was hard. It takes a commitment. Don't get me wrong. That's not an easy thing, meeting every week for 6 weeks and then meeting every other week for another 12 to 14 weeks. It takes a commitment that you got to do it. And what was helpful was that we had a group of people. We started out with, 12 or 13 folks, and we ended out, there were 5 or 6 of us that finished the program, right? But that was really helpful, that I had peers that I felt like I was, I had a responsibility to report back to them on how I was doing. And so you're in this together and you're going through this journey together for that entire year. And so that was really helpful to have those peers. And also throughout the whole year, I also involved my family, my wife, my kids, my friends, so that they knew what I was doing, so that they could help me be accountable as well, right? That they knew that I was on this journey and learning new things. And so that was helpful as well, I think. And then, the hours that were spent, I mean, it was really cool. We had a nutritionist come in from the hospital at American Fork and spent an evening, couple of hours with us, teaching us how to cook, good meals, and actually cooked for us. So we could taste that, healthy food actually can taste great and tastes really good. And so those were some of the impactful times, I think, going, like I said, going to the grocery store, having that chef come in to cook for us. And then the exercise, we went through a couple of nights of exercises and what we could do just within our own homes. And so, yeah, those were kind of the more impactful things.
That's awesome. So you've mentioned the structure of Way to Health a couple times, and maybe I forgot to say this at the beginning, but just so everybody is aware, Way to Health, like I said, is a year-long program, and like Jim was saying, it is more intense in the first 6 months. So every week, every other week, we have about 16 sessions spread out throughout that first 6 months, and then in the last 6 months, you start going to about every month. For a total of 23 sessions. And so for you, we've gotten some feedback from participants that, that last 6 months, it's a little bit harder to keep staying on track, right? You have lots of social support, you have that group that you feel like you're committed to, you've really gotten into this, you want to involve your family, just like you said. What made a difference in the last 6 months? What do you feel like motivated you to keep going?
Yeah, I don't remember how many times, but there were still regular check-ins with Michelle Francis, our nutritionist, our consultant. So I would actually go to American Fork Hospital and do a one-on-one with her, and we would do all the biometric screenings and check in to see how I was doing, monitor, the progress or regress or whatever it might be, and to do a level set to say, okay, what's worked, what hasn't worked, what concerns do you have? And so that's really what helped me in those final 6 months, was meeting with Michelle and still having that accountability that I knew I was going to go back and report to her. And I didn't want to let her down.
I don't think you could let a dietitian down. We tend to be fairly forgiving. We're not the food police, but I love that. Yeah. You recognize that your dietitian was also one of that sources of support, and you really wanted to collaborate with them as well.
Oh yeah, she was very, very kind all the way through, and yeah, no pressure, no No
We love Michelle.
hardcore work at all. She was great, really good.
Good. Yeah, she is excellent. We love having her on the Way to Health team. So, all right. Well, can you kind of give us an idea? I'm going to move forward. I have a few pictures that you sent us on our slides here. So, kind of give us an idea of so this is your before. Kind of tell us a little bit about your story in these pictures, anything before or during the program, and then I'm going to move to the after pictures, and you can kind of tell us a little bit about those. Yeah, tell us how you've been moving through the program and what's going on before and after here.
Yeah, so there's a before, and it's kind of interesting. That was actually at my son's white coat ceremony, his first day of medical school back in 2018, and so he's actually going to be graduating in May. So that's kind of fun to see that picture again. But as you can see there, that was kind of at one of my highest levels of weight, and I was playing a lot of tennis. But the thing is, my feet were just killing me, just my heels in particular. I would get done playing and I could barely walk to the car, and that was not fun. And I thought, God, this is just another thing to point that I needed to do something different, because I wanted to keep being active and I wanted to keep doing things, but it was hard because of, carrying that extra 25 pounds is not a good thing, health-wise. So that's kind of the before and kind of where I was at, and wanted to make some changes that I mentioned earlier today.
And here you are now.
Yeah, there's some after, and so, I was glad because the clothes, I had to get some new clothes, and that was kind of fun because you didn't have to get the extra large all the time. Now I can get the larges. I'm still very active. I play tennis probably 3 times a week, and I golf, go and walk. I'd never take a cart if I can help it. Playing football here with a couple of my sons-in-law. And like I said, it was the being active more often, and again, those lifestyle changes as far as food helped. One thing, Karlee, I just wanted to mention before as well, is another big thing that really helped me out is before, when I would lose weight and I would gain it back really quick, because what would happen is I would have a bad day. When I say bad day, I would eat a whole pizza, or, we'd have a huge family party and just eat lots and lots. And it's like, forget it. I'm just going to go back to where I was, right? And the thing is that Michelle helped me out with was that when I would have one of those days, and they're not bad days, they're enjoyable, right? Eating's fun. It's good. I love it. But when you do have one of those days where you eat more than you probably normally would, that's okay. Just make sure that you go back the very next day to where you need to be and get right back to the habits that you have. And so that was one thing I failed to mention earlier, but I just wanted to make sure it was clear that when you have a bad day, it's okay. You just move forward and go back to what works and what's helpful.
I love that you reframed it as they aren't bad days, right? They are normal people days. We are all normal humans who deserve to eat and deserve to have fun and have pleasure while we're eating. So yeah, I'm glad that your mindset was able to shift, and so that seems to have made a big difference for you.
Yeah, definitely. And when it comes to really good stuff, like, desserts, I didn't need to eat the whole big piece of cake. I just needed a slice of that, and I needed to enjoy that smaller slice while I was in the moment. And so that was a good thing that I learned too with the, eating habits that we had.
So in our last few minutes before we open it up for questions, I guess my last few questions are, like, how have you maintained the things you've implemented during the program? What are some of the easy things that you've been able to maintain? What are some of the challenging things over the last 3-ish years? And any advice for others?
Yeah, I honestly can't think of too many hard things, because again, once I changed my mindset that you can still eat, fun things, but just don't eat as many, and don't make it, an everyday thing that you're eating a lot. So again, every habit I had when I was entering all of the calories and just did that, it just became an everyday mindset. And so it's not like it burdens me when I sit down to eat. It just makes me realize, okay, here's what I should go to, and I should have more of that and less of that. And like I said, it's been it's been easy to keep those initial pounds off. Now I can say what's hard is I thought, okay, what if I can do the next 10 pounds, right? That's been hard to do that, other than getting COVID and not being able to taste things, and that was easy to lose that 10 pounds, right? But that's going to be my next step, my next journey. So I'm going to give it another, year or two, make sure that I hold steady where I'm at, and then recommit and get back into my binder, and see maybe what kind of changes I could make going forward. And I was going to mention too, the blood sugar level thing. It was not good. I was almost pre-diabetic. And after losing those first initial 15 pounds, I went back to my doctor, and he checked my blood sugar levels, and I was even below normal. And so that's and I talked to the doctor about that, and he just made the comment. He said, yeah, just a 10 to 15 pound reduction can really make a huge difference in blood sugar levels and staying away from, that type 2 diabetes. So anyway, just want to mention that.
And with Way to Health, we are CDC recognized, and that's what the research is showing. That's what we maintain our recognition off of, is just a 5 to 7% weight loss, and getting that 150 minutes of physical activity a week. So as people are doing that, which is what you have done, obviously we're seeing results, and that's amazing.
Yeah.
So any thoughts or advice for others if they are looking to get into Way to Health or a diabetes prevention program of some kind, or make changes in their lives? Yeah,
I just can't say enough how much I would recommend the Way to Health program. I mean, it's just been a life changer for me, but I also want to make it clear to everybody that it is a commitment. It's not, easy to start out with, but it's well worth it. And you've got lots of resources and lots of help along the way. And, Karlee and her team has set up some, this really, really great structured program that's fun too, frankly, along the way. And so I would just highly recommend it to anybody that's looking to improve their health, get more energy, feel better about things, and really make a change in your life. So yeah, 2 thumbs way up for the Way to Health program. I'm not just blowing sunshine. It really makes a difference, and I really am so happy with what I've been able to do.
Awesome. Well, thank you so much, Jim. We have about 5 minutes left. I'm just going to look at the chat really quick, just so that we are aware of what's going on there. But if you guys have questions, I think, Jessica, now's the time for questions, right?
Yes, we can open it up for questions. I think everyone the mics are muted just to reduce background noise. So if you'll put your questions in the chat, we can read them, and one of us can answer them. The last thing I would add is that we are giving away a couple of our Way to Health cookbooks that are called Cooking Your Way to Health. They're really popular. And so Patty will do the drawing and reach out to the winners, and we'll get those sent out to you. And then the slide in front of you that Karlee's sharing now is actually a QR code so that you can just scan and get connected to some of the services. Definitely right in the center is the specific program that Jim participated in, Way to Health. But we have a lot of health, wellness, and lifestyle services at Intermountain. There's nutrition services, so you can do one-on-one counseling with a registered dietitian, which it sounds like Jim also did. And then we also have a variety of services from wellness testing to fitness classes and personal lifestyle medicine consultations through our 5 Lidwell centers. And so feel free to scan those QR codes and it'll take you right to the website so you can find, I saw questions about locations and cost and things like that from Laura.
Okay, so I can jump in and start answering questions.
Perfect, yep.
So I love what's going on in chat. So with locations, I think, let me just pull up the Way to Health website. So this is our calendar site. This is the public facing site on our .org. But we had more cohorts upcoming that were in person, but with some of the COVID numbers, we are moving things over to virtual. So we do information sessions first. That way you get even more information about kind of what the commitment looks like. This is different than when Jim joined. Jim just called and was like, hey, can I do this? And they said, yep, sounds good. We'll give you more information as you get going. So we are doing a little bit more, but you can look through here. In fact, look, Jim is part of our wonderful menagerie of patients who gave us wonderful videos and stories. But if you're interested, feel free to sign up for one of our information sessions. When you click here, you'll just add it to your cart. These are our upcoming virtual sessions. Again, we don't have any in-person sessions until probably April, just depending on COVID numbers, but we will do virtual sessions. So feel free, this particular session is no commitment, this information session. So if you just want to know more, feel free to sign on. We have, it's every first Monday and every third Thursday. And the first Mondays are in the evening, third Thursdays are at noon. So if you want to learn more, feel free to sign up. It's just through our calendar site. And then we can register you from there if you feel like you want to make that commitment. Locations are all across the system. So we can probably find a location near you or do virtual. It looks like I think Dr. Joy had a question for Jim. So how did your participation in Way to Health impact your family's eating habits?
Oh, yeah, it's just my wife and I at home, so it's really just the two of us. But you know, we both definitely are eating healthier. And again, my kids. Oh, I should mention too. I forgot about this. My oldest daughter, Camille. She went through the Way to Health program as well and had really good success with that, and her story is out there on the website as well. I think we kind of got interviewed together, but she just barely had a little baby, and so she's back to getting back into those habits again. So it was a little bit of a challenge for her, that was, but she had really good success as well. So it was kind of a family thing, and that impacted us and helped us out both out.
Wonderful. Well, we do try to keep it right at 30 minutes, so that's the quick, digestible bite. And so I'm going to just take over and maybe close this out. I think the rest of the comments, Jim, there's some comments in the chat just congratulating you, giving you kudos, and saying how inspiring your journey has been. So thank you so much for being willing to share with us. Karlee, thank you so much for facilitating today. And it looks like the rest of the questions were related to cost. And Wendy, thanks for putting some information in the chat and questions about locations and how often it's taught. And so you can access that just by scanning that QR code. We can put it back up just in the last few minutes, but have a great evening. I'll monitor the chat for just another minute if you have any other questions. And thanks again for being here, guys. The recording of this will be posted to our YouTube channel and through the Healthy at Home website. So watch for that recording if you would like to view it a little later. Have a great night.